Good morning, everyone. I think we'll go ahead and get started, and as people join us, awesome. Thanks so much for being here with us today. We have a whole lot coming up here in October and November that we're going to discuss and share. So thanks so much for being here. I'm just going to pull up a PowerPoint presentation, and then I'm going to hand it over to Francisco, who is our development manager here in San Diego.
So I'm going to give a short program update on our health equity initiatives. So as many of you know, Komen has long recognized and worked to bring attention to disparities in breast cancer diagnosis, care, and treatment. For example, we know, and we've known for a long time, that Black and African American women are more likely to be diagnosed with breast cancer at a younger age, at later stages, and with more aggressive types of breast cancer. And because of that, they're currently up to 40 times more likely to die from the breast cancer than other racial or ethnic groups. But what we really needed to understand better, I think, is the why behind that, so that we can effectively address these disparities. And so to accomplish that, Komen, over the last few years, conducted a pretty extensive analysis to better understand, the drivers and underlying causes, of these disparities within specifically 10 U.S. metro areas, including LA, where the disparities are the highest. And the result of that study is a new series of reports entitled Closing the Breast Cancer Gap, a Roadmap to Save the Lives of Black Women in America, which outlines, the multitude of elements, whether they be biological factors or, widespread systemic failures that have resulted in a lot of the disparities that we're seeing within the Black and African American community. And so in response to that report, Komen is launching the next phase of our health equity work, which we're calling Stand for Her, capital H.E.R, a health equity revolution. And can we go to the next slide, please? And so Stand for Her is really a focused initiative to decrease breast cancer disparities within the Black community by Oh, sorry about that. I somehow got muted. So Stand for Her, is a focused initiative, and our goal really is to decrease the disparities that we're seeing within the Black community, within those 10 metro areas that you see on your screen right now, by 25%. Because we know that within those 10 metro areas, the disparity rate can be as high as 74%. So, to us, that's really something that needs to change. And so, within those focus areas, we're implementing, a few different strategies and making, really targeted investments with our donor funds to improve the quality of breast cancer care within those communities and also overcome the existing barriers that we're seeing. And some of these things include improving treatment at specific healthcare facilities in those areas, connecting Black families to culturally competent patient navigators and educational resources, and then also providing emotional support and addressing financial needs. And so you can find more detail on the initiative and the full report that I just mentioned on our health equity webpage. And Leah, I believe, will be pasting that link into the chat now. And then lastly, at our town hall session in November, we hope to have a representative from our Stand for Her initiative on to join us and provide more in-depth information on their efforts and the focus of the initiative. And then with that, I will turn it over to Leah.
Thank you, Francisco, for the update. So as Meredith mentioned, we have been spending our summer months really looking ahead to the fall and trying to plan a robust and diverse opportunities for engagement with our events coming up. So I'm excited to share more details about those now with you. We can go to the next slide. And so our first upcoming events are going to be our kickoffs for our walk. And so these are going to be our first is our virtual, which is on Tuesday, August 24th. And we have this scheduled to coincide with our National Komen Fundraising Day, which is a nationwide initiative to have the most donations that you can on August 25th. So we're going to kind of outline all of the challenge and the incentives that are going on with this campaign during our virtual. And then we're also going to provide tips, updates for our new walk format and the experience that we are planning for everyone, and get updates from all of our fellow team captains and all of our participants. As you can see, so the National Komen Fundraising Day is the most number of donors that you can get to donate to your fundraising on August 25th. And for each event, so throughout the nation, all of the races and walks, the person that receives the most donations will receive the Bluetooth headphones that you see on the screen. And then the person throughout the nation that receives the most donations will get this prize package on the right over here. And so that's something that is done separately from all of our other fundraising incentives that we have for our walk. So just a little bit of extra push. One of the other benefits from this is that it'll be a triple match going to Komen National for research funding. So your donations on that day will really drive more fundraising to go to research. So, and then also we're doing a in-person meetup on Saturday, August 28th at our new walk site in Balboa Park. And so our new walk site is just slightly more south than it has been in the past, but it's still in Balboa Park. You'll be very familiar with the location, but we want to meet up and just have everybody take a walk through with us as we present what our vision is for the day. So we're excited about that. So we hope that you can join us. For those two events, we'll be sending out invitations personally later this week, and then also be sharing in our Facebook groups and sending out reminders as the dates get closer. And we are kicking off our Breast Cancer Awareness Month of October with our Dine Out for the Cure on Friday, October 1st. This is just like all previous Dine Outs, where we're just supporting our local dining scene while also supporting Komen. So we're excited to have you go out, eat out for breakfast, lunch, dinner, grabbing a coffee, taking home a cupcake. So everyone will be updated on the details of participating restaurants and their promotions and what they're offering as we get closer to the date. But please save that date and dine out for Komen on October 1st. And we've got, we're bringing back Row for the Cure. So we have San Diego Crew Classic is our host of this event this year. Very same footprint that we've had in the past, where we'll be at North Ski Beach starting early in the morning, having the regatta. Registration will be opening soon. So this is on Saturday, October 9th. We're really excited to have this event come back after taking 2020 off. And if you are a rower and want to get in on the action, just stay tuned for more information. We've got Regatta Central, we'll be registering, and then we'll have opportunities for engagement and fundraising as well. And I'll hand it over to Meredith to update everyone on Stand Up for the Cure.
Awesome, thanks, Leah. So this year we're participating in something called Stand Up for the Cure. It has been happening up with our fellow folks up in Orange County for many years. And we have started a team that we'd love for you to join if you'd like to register. And basically go out and stand up where you are. So basically get a stand-up paddleboard and just spend the day either with your family, friends, or on your own. We will give you some dates of when we're going to, our team will actually be out there doing it. But here's, we'll send the link in the chat. I think Leah might have put it in there. If you'd like to join our team, and we'd love to have you with myself, Leah, Francisco, and all the others who have already joined. So something new this year and something really fun and different that we haven't done in the past. Okay, and then as Leah talked about, our More Than Pink Walk is on Sunday, November 7th. It's always the day after daylight savings. So we are really doing well with registrations so far, and people keep pinging me and asking me, is it gonna be in person? As of right now, we have it set for in person. Of course, we will monitor if state, county, city guidelines change. But as of right now, everything is a go, and we are planning to have an in-person event. It will be a smaller scale than what we typically have had. And as Leah said, we have moved the footprint a bit south on 6th Avenue. So that's going to allow for more space and folks to be able to practice more social distancing. The other really exciting thing is we're going to have a lot of interactive and fun events this year. So we're hoping that you can come and join us. It is free to register. We encourage people to fundraise and to raise that $100 or more, but it is free to join. So we'd love to have all of you join us, start teams, or if you know of folks who are interested in joining and they need some support, Francisco, myself, or Leah are happy to jump on a call, help set up in any way, any team. So please let us know how we can help. And I'm going to pass it back over to Leah.
Awesome, thank you. So I know that we have been sharing that we're planning this, and we're just wanting to provide a really fun event with a kind of like a new refresh that provides, just a lot of areas of engagement pre and post walk. So we will be implementing all sorts of allowances for social distancing and being very aware of all of the engagement opportunities that we're adding just to make sure that they are safe and very COVID friendly. And so while we're doing that, we have a great area and space to do that. So we hope that you'll come out and join us on November 7th. And then we also are adding, we have another campaign that will be running simultaneously if for anyone that doesn't feel comfortable coming out in person or isn't here in San Diego locally and still would like to support us. So there are going to be virtual components on November 7th as well. So, and next slide. And we do have our upcoming town halls, which will be Tuesday, November 9th, February 8th, and May 10th in 2022. Sorry, that Tuesday, February 8th is 2022. So we're looking ahead and we're excited to continue these just to provide updates and information to the community. So save the dates and we'll send out invitations as we get nearer to those. And next slide. And I'd like to hand it over to Francisco to highlight our community partner.
Thanks, Leah. So now we just wanted to take a minute to spotlight another one of our amazing community partners, Sequan Casino Resort, who have been a Race for the Cure and now More Than Pink Walk sponsor since 1999. And then Sequan has also had the largest corporate team at our walk for many years now, with typically around 800 team members who come out to support our event every year. So, we're really grateful for all of their support. I just want to, give a little shout out and thank you to them for supporting our local breast cancer community. Next slide, please. And I just wanted to give, a few more shout outs to some of our top fundraisers and top teams so far. So for our top 5 fundraisers, we have Susie Paul, who's been walking with us, for more than a decade now. We have Alicia Wadsworth from our friends at Plaza Home Mortgage, Trisha McLean, Ann Texas, who has been walking with us, I believe, for pretty much since the beginning of the race, so about 24 years. And then our good friend Mary Brewer. And then for top teams, we have Hoofers with Hooters, Kicking Assets with more of our friends from Plaza Home Mortgage, the Opulence Squad with our friends from Opulence Salon and Med Spa, Boomer Bosom Buddies, and then the Texas Treasure Chest. And we hope that many of you are able to join our top teams and fundraisers as well. Back to you, Leah, or Meredith, I'm sorry.
So we wanted really just to talk about events and then open this town hall up for more questions. Shannon, I know you're on the call. I don't know if you want to share that flyer that you sent to me that perhaps folks can send out to their networks as well for breast cancer patients. But feel free to drop that in the chat, and just want to open it up to all of you and hear from all of you.
There was just a notice I got from Dr. Elaine Tanaka, and I don't know how to, I guess I could just do the survey. I haven't looked at it in detail, but she did have some instructions on the email. So I don't know if it's easier to just do, I don't know how to do the whole email into the chat. So, but I can do I'll try to do the survey if I can. If I can't, maybe you could send it out to the network.
Sure, we can do that.
Okay. Oh, I have a question. I know that a lot of the fundraising is going to the treatment fund assistance line that's national. Will there be any additional local resources that our walk will be funding?
So for treatment assistance, are you talking about, are we going to have a treatment assistance fund here in San Diego specifically?
Well, I know there's the national number, right, that anyone can call from anywhere. I didn't know if there was going to be any specific funds designated for San Diego from the walk.
Yes, so no, the funds will not be specifically designated for San Diego for the walk. They will be used to support breast cancer patients all over the US. So that goes along with all of the walks.
Perfect.
Throughout the United States. And we have over 60 walks happening this year. So it will go towards research, our helpline, the treatment assistance program, as you mentioned, Shannon, and then our advocacy efforts as well. So sort of wherever the greatest need is, we have done $14 million this year in research grants. So Komen is investing more in some new initiatives, I would say, than what they have done. And in addition, the treatment assistance program, it just continues to climb the numbers. And so more and more of our dollars are going towards that direct patient support of giving checks to patients who are in need. But that is all throughout the US. So what I do get asked a lot is, can my money be restricted for San Diego? And the answer is yes. If you send a check-in or you email me and say that you want this donation specifically for people in San Diego, we can restrict it. So if that is something that is really important to you, please know that we will do whatever each donor intends for us to do. What I will say from the other side is if it is a large sum of money and we have to go through multiple channels, accounting and things like that, we can really earmark that money for programs in San Diego, for those people in San Diego, calling the helpline or getting treatment assistance. However, if it is a smaller donation, as we're going through the accounting process, it does take a lot of extra time on the back end to make sure that that money goes and stays in San Diego. So if we had folks all over the US and every donation that came in, if everyone was asking for their money to stay locally in their market, it could possibly cause challenges for us internally. So So
The
I just,
logistics nightmare, right?
yeah, I want to give people both perspectives of
Yeah.
absolutely we will do, whatever it is that you intend for where you want your money to go. That is always what Komen will do. However, there is a logistics nightmare, as you said.
Okay.
So just keep that in mind. But that is a question I do get asked a lot about. So I appreciate that you brought it up as well, Shannon.
Well, and that's good to know. So if people ask me, then I can let them know what the options are as well. Okay,
Yeah,
perfect.
exactly.
Thanks so much.
Yeah. I see lots of our known faces, but it is early, so.
I have another question then. If anyone, if the agencies or organizations want to table at the event, who would they contact? Like if Every Woman Counts, if Joanne had a community health worker or someone to bring materials and brochures, are you doing that for this year's event? You're muted.
Oh, I wonder how I got muted. Weird. Yes, you can contact myself, Leah or Francisco. Any of us can help you with that. Yes, we do want our community partners out at the walk. We are trying to make it more quote, COVID friendly, as Leah said. So we're trying to use more QR codes, do less, hands touching things. So if you have technology or flyers to be able to do that, or poster boards or something like that, Shannon, and others, we prefer that our community partners find other ways to get out information, and us, giving out paper flyers. Just to
I'll
keep,
ask Joanne what we have for our program.
yeah, that would be great.
Okay.
So if there's no questions, I don't know if any of you want to share. I see Mary's on, and Mary, you're doing such an amazing job. So I don't know if you want to share with the group kind of your what you're doing this year and how things are going. But we'd love to, hear from you.
Yeah, I actually was approached by my friend Irma from the Baby Boomers meetup group, because they'd been walking with me previously, and she asked if we were doing it this year, and she really wants to do it again. So we're going to put it out on our meetup site to get more people to sign up for Baby Boomers, for the Boomer Bosom Buddies. And so my question to you is, I see we have a 7:30 opening ceremony. Are you doing a survivors thing again this year or not?
So we will not be doing a survivor parade this year, Survivor Thriver parade, as we typically have done. What I am looking to do is to create a space that is socially distant for our survivors and thrivers to be closer to the stage if they want to participate in opening ceremonies. The tent is going to be larger this year. I hope that gives you a yay inside. So we are going to have a larger tent for our survivors and thrivers. I do want to introduce Barbara H.E.R, who is our lovely chair this year, and she is doing all things walk, and she is also, an asset for any of you who are interested in coming to the event or need support. But Barbara has been walking with us for how many years now, Barbara? 23?
24.
24. So she knows a little bit about this, but she's really helping us and leading our team. Paula sits on that committee as well. So I know many of you have come out and you've supported by volunteering. So we would still, love to have volunteers join us that day or join us in the preparation. If you have ideas or folks that for instance, Shannon, you have some people who are interested in coming. It's just a great way to bring the community together. And right now it's really, really tough. Most, community events are like this, they're on Zoom. So, we do need to balance the safety of people but also where we're able to provide those in-person experiences. I can tell you I've been getting a lot of phone calls regarding support groups, and people really want to be in person. They just want to be able to talk to somebody face to face about what they're going through. It's just a bit of a different experience. So I think when we come together and we share, what's happening in our community, and we share our, our own stories, and we're able to, be there and listen to someone else, it really provides a richer environment and perspective. I know, Sam, you've been part of the walk for many, many years also. So you know what that feeling is like for those who come and spend time together.
Yeah, this is 20 years for me this year, doing the walk. The first 2 years I did it for my aunt, and since then it's been for me. I'm a survivor since 2003 of stage 3. But I agree with you. Being there in person, it just is so, I can't explain it, energizing when you see that sea of pink, other people and all the years that they've survived, and it just, it's kind of like, okay, I'm here another year. Let's go forward. It's a great experience. Oh, I had one more question. I know you're talking about not having a lot of handouts and things. Are we carrying signs for our teams?
We haven't gotten there yet, so we likely will have that. We will have yard signs that we can deliver to your homes to be able to put outside of your home if you would like that. But we likely probably will. We're just still kind of working on some of those logistical pieces, but more to come as we get further along in the process. Right now, we're really encouraging people to register. Especially past participants. Paula is helping us make phone calls for past participants. She's also been walking for many, many years as well. So really glad to have her, her encouragement of others and getting more people signed up this year. There's lots of questions, so I encourage you, if people are asking questions of you, just please, send them to myself, Francisco, or Leah to get, those questions answered. We're happy to email, talk to people, meet people, whatever it is, and however we can be helpful, especially in this new environment. And I know we're gonna go over quite a few new things, like being able to use the app this year to upload donations. So there's a lot of really cool stuff that we kind of rolled out this year that we will be sharing at our virtual and our in-person walk events that Leah mentioned early on in the conversation. So hopefully you all can join. We were holding those nuggets for those so that we didn't go into too much detail and really had more time in this meeting to hear from all of you and to get questions answered because there's just a lot of moving pieces right now with Komen. So we want to make sure that this time is of value to you, and you get to ask the questions that you have, and you get the information that you need, and very transparent about what we're doing here in San Diego and how we're doing it.
Okay, I had one more question. When you sign up, I know when I signed up, you had a choice of signing up to walk virtually or in person. Now, does it matter if somebody signs up to do virtually and they decide to join us in person?
No, it doesn't matter.
Okay. So they can do it either way. Okay.
Yeah, we just want to know how many people will be there. As you know, we have food in the Survivor, Thriver, Hope Village area. So we want to make sure that we can accommodate the number of people who will be in person. We rely heavily on donations, especially food donations. So we just want to make sure that we know how many people, and then we will be staggering start times for the walk this year. So we will want to know you know, the number of people. So as accurate as we can be, but we understand that sometimes people walk by in the park and then they just decide to walk with us. So we invite anyone and everyone who, you know, unfortunately that breast cancer has touched their lives, but being able to come together as a community, because this is one of the, you know, October, November are the times that we actually get to spend time together and really, you know, connect with one another in a different way.
Okay. I had a lot of people who were kind of worried about walking in person. That's why I asked that question. I'm going to encourage them to join virtually, at least, to be part of our team.
Yes, and we will have an opening ceremonies video that will be virtual. We have some other virtual components. We don't want anyone to feel left out of the fun. So we definitely want to be able to provide, you know, this hybrid model. I can't say it's going to be perfect because it's going to be the first year that we're going to roll out a hybrid model. But as with everything, you know, we are always looking to improve in the way that we do things. We've had Sleep In for the Cure forever. Not many people have done the Sleep In for the Cure over the years, but you know, this year obviously it's going to be more widely popular because you know, we know that not everybody feels comfortable coming out, and we still want our community together in whatever way that makes sense for them, for each person.
Meredith, I don't have a question. I just want to say thank you. Because I'm a walker and I'm on different things. And I just wanted to get on this call simply for what you just said, to be part of the community. And so it's just so nice and comforting in a way to see Leah's background with the logo and to hear from everybody. And yes, I know it's been such a crazy time for all of us. And I just want to say thank you. It's hard to stay flexible, you know, it's hard to answer questions, and we all get that, but we're still here. You're doing a great job, and just looking forward to the walk. I don't know yet. I haven't decided either. Will I do it virtual or in person? But always with you guys in spirit. So just thanks for putting this on. You're doing a great job, all of you.
Oh, thank you, Michelle. I know you've been a big supporter of ours for a long time, so we really appreciate you. You just being here today too. I know, you know, this is a Tuesday, and you know, you guys have other things that I'm sure, you know, want to take up your time, but we really appreciate you giving us the space and time to be able to, you know, provide these town halls. And this is what it's really about, is trying to create that community. We're hoping to have our next town hall in person and virtual for any of those who want to be in person. So stay tuned when you get the invitation for that next town hall that Leah shared earlier. So that will be, we'll take a deeper dive into our programs, and we'll also report out, you know, kind of what happened with the walk and some of the other events, and then looking forward into 2022 and, you know, what do we have planned for 2022? All we know is we don't know. That's what we've learned. So, you know, we keep making plans and move forward with those. But like you said, Michelle, just being flexible is really all that you can do. So, other questions before we jump off? I know we've got just a few minutes left on our call.
Thank you all so much.
Okay, Leah, you want to round us out?
I do. I want to touch on something that Michelle said. Thank you for joining, Michelle. And if anybody wants this background, I'm more than happy to share it with you. And so you can show your support whenever you're doing all of your Zoom calls throughout the day, even if it's just when you're joining our Zoom calls. So just email me or hit me up on our Facebook group. We'll probably post it there as well. So we're excited to have everybody represent San Diego, and just thank you all for joining us. We'll send out a recap of everything that we covered today for anybody that couldn't join, but thank you. We appreciate your time and hope you have a great rest of your day.
We thank you.
Thank you.
Take care, everybody.
You too.